Molly Uhe-Edmonds, Director of Student Care at the Illinois State Board of Education. And I have two of our partners here. We are working with University of Illinois Springfield on reduction of racial disproportionality of discipline, but also including a mental health and trauma component. So I have Dr. Betsy Goulet, who I'll turn it over to for her introduction.
I'm Betsy. I'm with the University of Illinois Springfield. I'm faculty in the School of Public Management and Policy, where I coordinate the Child Advocacy Studies curriculum. And my background is child protection, child welfare, and I'm just really glad to be here. And our partnership with ISB has evolved over the last year, and we're very excited about some of the components that we're hopeful to spend some time talking about today. Josh.
Hello, I'm Josh Friedman. I'm the doctoral fellow at University of Illinois Springfield, working with Dr. Goulet. My background has primarily been law enforcement for the past decade. And when I got involved in the doctoral program at UIS, I started working with Dr. Goulet and Molly on the ISB projects. And the application is obviously pretty linear between law enforcement and mental health in children. And so I've been getting more engaged in that process, and we're hoping to expand it to law enforcement officers and how they can play a role, specifically school resource officers, who are obviously an integral role in the school process for children.
Well, thank you all for joining today. So we had some questions for you in honor of Children's Mental Health Week this week. Our first question was, can you speak to the general state of children's mental health of Illinois, either your concerns or hopes for the future?
You know, I think that this is a full circle for me, and I don't even think my colleagues know this, but I was in the room in 2001 when I was the children's policy advisor for the Attorney General, when we started having this conversation, which was pretty innovative at the time to even be talking about children's mental health concerns. There wasn't a lot of research, and this goes back to work that I did with Barbara Shaw and Jan Holcomb in the early days of mental health, and starting to look earlier and earlier at what was happening with children. Here we are. I helped with the legislation when it came out in 2003 and stayed on the committee that did the first report to the governor. So to sit in this position now, working with ISB, to look at everything that you have done in the group that has grown and produced so much important work. We look now at the pandemic and we try to see what that has done, but this is an issue that the pandemic shone a spotlight on. It's been a concern. Teachers have known about children's mental health from decades of their time spent in the classroom. Molly was in the classroom. Molly was an administrator. She can point to children who are adults now that she had concerns about when they were in the classroom. So just this week, the American Academy of Pediatrics came out just 2 days ago saying this is urgent. It is an epidemic. We cannot, spin our wheels. We have to come together. Every profession, everyone who interacts, every child serving profession has to be at the forefront of this issue. No time to waste. And I think that's how we feel right now, where we have this opportunity to work with classroom teachers to build their capacity, to raise awareness about trauma and adversity in the classroom. And as Josh pointed out, that landscape includes those professionals who have been asked to protect the students in the classroom. But they can't be, they cannot be at odds with the teachers. They have to be partners. And they have to, all of them, understand that these are children who are coming into the classroom with trauma, and it's manifested. It is very different from one child to the next. So you really have to pay attention. You have to ask the right questions. And I think Illinois continues to stand out across the nation, examining this, exploring it, and looking for the solutions so that these children are not on that pathway where, you know, we know what their adult life will look like if they aren't identified early enough.
Very thorough answer. Anyone want to add to that response too?
Sorry, I went too.
No, that was great.
I'm not following that, Josh. I mean, you've seen it from a different perspective.
Yeah, I would emphasize what Dr. Goulet said about a number of different professionals being involved and combining as one bigger entity rather than working independent of one another. The team approach to doing this, you know, in my experiences in law enforcement, is that we kind of handle what traditionally we've handled what slips through the cracks of other agencies. But I think the emphasis now and our hope for the future is that we can work as a group to identify the needs of children earlier in their lives, so we can address those needs and prevent them from being, you know, a problem for law enforcement to handle later in life. And then just so they can live a better, more successful life themselves. And I think that's one of the things that we're really trying to work hard at, having these partnerships that are maybe less than traditional.
Yeah. And the night before, as Molly mentioned, is a way for us to immerse teachers in what happens in a child's home. Far too frequently, it's the intersection and the co-occurrence of domestic violence and maltreatment, child maltreatment, but it's the story of what happened the night before a child shows up in class the next day. And instead of looking at a child who's sleepy or hungry or acting out or you know, distracting other kids and seeing that as, you know, getting angry or frustrated with that child, being able to ask that question, what happened last night? What happened last week? What are you dealing with that when you come into the classroom, you can't regulate, you can't focus? There's so many of these kids that are carrying that weight with them, and the teachers are being asked to do so much that it's really overwhelming to also have to spend so much time being mindful of a child's behavior and what has shifted perhaps in a child's life. So we're opening that up for their awareness, asking questions about it, hoping they can relate some of their own experiences, you know, remembering those kids. When I did teacher interviews for my dissertation, I remember one teacher saying to me, I'll never forget it, because she was very, very proud of herself when she said, I never lost a kid on my watch. And then she paused for a moment and the tears came down and she said, that's not true. There had to have been kids that I didn't know what questions to ask. And that has just always been something that I'll remember how she felt when, as a retired teacher looking back, she had these regrets. We don't want teachers to have regrets. We want them to have the tools and the knowledge and the expertise. And it takes a team, like Josh said, it can't be all on them. There have to be enough school psychologists and school social workers and counselors to share in that identification and to find the resources, and there have to be resources.
Thank you for lifting those issues up. I was just talking to a friend who's a teacher about these exact same issues just this past weekend. So it definitely affects so many people. And I think she's been changing her approach now too, because I think that's just an important thing to highlight. It kind of goes under the surface a lot of the times. So on to just in regards to the plan's 5 goals that we've been working on. I was curious on why these goals are imperative for children's mental health and wellness, and in your initial thoughts on the recommendations.
I'm waiting for you, Molly.
You're doing so well. And Juliana, is there anything specifically, because I know we've talked about a resource guide is one in my group that we're talking about. And there are all of these great opportunities for individuals outside of the school walls to also be a part of this conversation. You know, ISB has a lot of great resources. The Department of Human Rights, the Department of Human Services, Health and Family Services, but there isn't a guide to show what is out there, what's being offered. Right. There's some overlap. The reason I was able to connect with Dr. Goulet, we worked together during my time at DCFS, and her simulation trainings are amazing. And in child welfare and education, we're dealing with the same types of kids, law enforcement, DCFS, education. We're dealing with the same types of kids. And I also think something that the Student Advisory Council made me realize, you know, we have those students that have acute mental health needs, that maybe talking to the school counselor or school social worker is more than enough, or talking to the teacher who actually takes the time to understand what's going on in that student's life at that time. Then we have these students that we're having a hard time finding placements for, and their families are begging us for more resources. And these are very vulnerable kids, very vulnerable families. And so we have to have a resource guide that deals with the acute all the way to the most severe mental health needs, and be able to provide families that scope of work to find where to go. It's so difficult and so isolating. And I'm glad that we're meeting as a group and coming up with these goals, but we've got to figure out a better way to communicate to families where they can go for help.
Yeah, that's been a very main thread throughout the work that we've discovered over the 17-month development process, and just like the lack of coordination and duplication of efforts. So that's definitely a really important component of the plan that we are going to implement as the next steps. For the third question, I was wondering if you could describe your experience working on the plan, or how this connects, or what we're discussing today connects to your work or experiences as well.
In working on the plan, again, you know, Dr. Goulet and Josh both talked about how what goes on in the home, or behaviors that are exhibited in the school. I think it was you, Betsy, that said, you know, we have to stop looking at the student as, you know, what's wrong with you, or you're bad, and more what has happened to you, and why are you hurt. So those are the things that I see the connection. And I just hope, you know, Betsy again was saying that she started this work in 2001. And the pandemic did shine a bright light on mental health. I just hope that this isn't a fad and it goes away, because we haven't figured out how to fix this issue. I'm glad that everybody's talking about it. I mean, we have Josh here that spent years in law enforcement. Why aren't we bringing more of the players to the table that see what the extreme version of being denied mental health care, vulnerabilities, what happens to them on the other end when we don't all connect with our resources and our knowledge of what's going on?
That's been a big part of our discussion in the last, well, for longer than I've even been involved, but certainly the time I've been involved for the last year, is how can we engage more people and have better communication in order to not have that overlap that you were discussing, where everybody's trying to do similar things, but no one's talking to one another about it. But then let other people know that this is an issue that you can address as well, which is frustrating. I was having a conversation with a former coworker who's still a police officer and actually in a school that I will not name. And he mentioned something being a school issue and not a school resource officer issue. And I thought, well, that's not the case. you are a resource to these kids. And that is something that you have the ability, the unique ability to address that somebody else might not have. And you have specific experiences and training that make you better qualified to address it. And I thought this is one of the things that we can address with what we're doing is enlightening people and letting them know what part they can play to help impact this positively.
And I think that goes to what, we've heard from our partners, Dr. Okanafua, who has brought his research to Illinois, that even a 40-minute module on empathic instruction has had such a significant impact on how teachers view their relationships in the classroom. And it's reducing this disproportionate use of exclusionary discipline, the suspension rate, by 50%. And so, everything that we know about this research of these classroom moments that end up defining who that child is for the rest of their career. In elementary, all the way through to high school, they get labeled. And he talks about that because he was one of those kids. He was suspended, he was expelled. And had it not been for teachers who took an interest and other people in his life who kind of gently redirected him and saw who he was, not the label, but who he was, and kept him on that pathway. This is an amazing gentleman, young man who has now turned all of his questions about who was I, what happened to me, and now has created these opportunities for other teachers to be that person in a child's life, to know what they're looking at and to be able to direct the child, and as Molly points out, the family, to the resources. So we have it's an imbalance. We have far too many kids that are in this 20% of children who have been identified. That's a lot of kids. And the resources, far fewer. So until we get the policies that you're working on and the money to follow, we're going to identify kids. We're going to do a much better job at that. But then it's going to end there. And we're not going to get the kids and the families the services they need to make that change that's meaningful and means that the next year the child goes into class, they're thriving, they're productive, they're safe. Because we know one of the core concerns with trauma for a child is danger and safety. And that is part of their wellness, is not constantly feeling that something else is going to happen to them. You can't take a test when your major concern is what happens when you go home tonight. It just doesn't, your brain can't handle all of that as a 9-year-old or even a 15-year-old. We know that about the neurobiological impact of trauma.
And everything Dr. Goulet just said really highlights the importance of some of the training that we're implementing, especially the night before, is enabling those people to realize that they can be that resource for the children that might not exist elsewhere, or that the child themselves might not have access to, because when they go home, they might not be in a position where someone's looking out for their best interests. And when they spend 7 or 8 hours a day, 5 days a week at school, that's a building full of their best resources. So let's bolster that the best we can and give them what they need.
I can't thank you enough for sharing each of your unique experiences too. I definitely think throughout the planning and development process, trauma-informed practices too has been a huge component of what we've been working on. But it just proves we have a lot of work ahead of us. So we're just getting started. On that note too, I was curious if you all had any final thoughts that you wanted to share on child and family mental health and wellness.
I just one thing that I'm committed to, I've been, you know, my entire life in this notion of child welfare and child protection. I think one of the most important things we can do from a policy standpoint and communication, like we've all talked about, is shifting that mindset to child and family well-being. I think that's so positive. It's so much more. It's compelling. It says we can get there. That should be our goal: child and family well-being, and not, you know, not looking at it as a negative, but as something a community should strive to do. So I think everything that you have done, even, you know, its earlier origins in these conversations about, you know, we didn't even talk about trauma in 2001. We hadn't really applied the science of ACEs yet. But, you know, I'll stop with this thought. I had a student ask me a couple weeks ago, we were on the module with ACEs in the class I teach on child maltreatment. And she just had this look on her face where I felt like she wanted to say something, but maybe had to be invited to say it. And she said, I said, what are you thinking about? She said, why did nobody tell me about ACEs when I was younger? I said, what are you thinking? What do you think the impact would have been? She goes, would have spent far less time wondering what was wrong with me. And I thought, if we can do anything, that message needs to be part of more conversations in younger, you know, in a health class in high school. That's part of a child's mental health, is to feel better about themselves. And she had been carrying the weight of her ACEs with her all the way to college, when we could have short-circuited that. We could have said, nothing wrong with you. This is what you lived through. And you lived through it.
My takeaway is that it can't be something that's divisive. You will always, I was in a presentation yesterday with teachers at a high school here in Springfield, and they feel like so much of the pressure is put on the individuals within the school building that they don't know how much more they can take on. There's all these different facets of education that they have to encounter, and they're dealing with their own trauma and their own mental health needs. So instead of it being something that, you know, is within those walls, bringing in other community members like law enforcement, like our university partners, our state agencies, being able to share resources and not being so siloed. Or thinking that, you know, because one is acting like an expert in one area, that we're saying to another agency that they're not. So there's so much communication that needs to happen. And there also needs to be a real focus on exactly what it is that we need to tackle. Again, when I go to the acute to severe, it's almost like the students that have special needs for learning. We have our special ed students all the way to our advanced learners, and then sometimes those in between are lost. I just don't want those in between to get lost.
Joshua, any final thoughts?
No, I really think that Molly and Betsy have summed it up very well.
Well, I cannot thank you enough for each of you sharing your stories and being so vulnerable with sharing that too, and for all of your leadership in improving the well-being of youth and their families. I mean, you've all made such an impact, and we're hoping to continue to work on all of these issues that were mentioned today in our plan as we move on to the implementation phase too.
Very exciting, and thank you for everything that you're doing. It's something else to be proud to be in Illinois.